Thank you. All right, we're getting ready. Good morning, listeners across the Upper Cumberland. Spring is almost here. Hopefully the worst of the weather is behind us now. It only took the snowstorm and ice weather a couple of weeks ago to let us appreciate that spring is around the corner. We want to give a shout out to our TDOT and Highway Department and our City Public Works employees that work diligently across that week of bad weather to keep our roads safe and our motorists are on the roads being able to get to their destinations. The safety and security of all of our residents is paramount, of course, to our success as a community. And our emergency personnel did exceptional service during the ice storm. And as we're coming up upon the year anniversary of the tornadoes that wreaked havoc across Middle Tennessee, those emergency personnel still need to receive a shout out. It's been a year since the pandemic was announced, and the challenges of COVID continue to unfold around us each day. With few plans in place on a national or state level, most of us understood fairly quickly that Warren County and most communities were on our own. Our county's COVID preparedness team responded quickly, and within a few days, we had mobilized and taken action to mitigate and contain the greatest health crisis in 100 years to face our nation. And nothing has been easy, as we know. Not everyone has been happy. We don't like masks. We don't like the social distancing. But with 500,000 Americans dead from this virus, we all have realized the critical nature of this pandemic. And those families who have been affected by COVID with deaths or hospitalizations know exactly what we're talking about here. It's still a serious issue. We still have challenges ahead. So we want to applaud each and every person that rolled up their sleeves and went to work. Warren County fared better than many rural communities in the Upper Cumberland and across the state. But we worked collectively as a team to do the right thing. It may not have been the popular thing, it may have not been the political thing, but we did the right thing. To do a little quote, sometimes the right path is not always the easiest. So today we welcome Dr. James Gray, who's the Secretary of the Upper Cumberland Medical Society. He's got a medical degree from the College of Georgia. He did his residency at Vanderbilt. He's been a specialist in OB/GYN for 40 plus years, worked for the Department of Health, and still practices as a special volunteer physician. To do another little quote, to keep the body in good health is a duty. Otherwise, we shall not be able to keep our mind strong and clear. So we welcome you, Dr. Gray, today. I hope everything is well in Cookeville. It's been a journey over the last course of the year, and how things have evolved have not suited everyone, but we did what we had to do. So if you'd like to just give a little overview of what the health status is across the Upper Cumberland and across the state, and a little bit about your perspective on the rollout of the vaccines, we would appreciate it.
Okay, thank you, Mr. Haley. I will tell you that Warren County stands out as an example for the entire Upper Cumberland with this. Right now, it's very difficult to interpret the state numbers on cases, and it's causing, I think, a lot of confusion. We need to be sure that we don't let our guard down seeing some of these numbers. Remember that over the holidays, state workers tend to take leave, and one of the things that can wait is putting in the deaths that occurred over the holidays. And I think that has happened. Another thing that is kind of going on is that the people that were doing testing now are trying to get these shots in the arms, which is a good thing, but I think we have to be careful about how we interpret the data. But one data that is strong is the amount of deaths, and that's where I think Warren County really shines. You've had 75 deaths since the epidemic started. You've got 41 people. If you do the math on that, that's 182 per 100,000. And I know these numbers are confusing, but I'll try to put those together in perspective for you. The Upper Cumberland region has had 126 deaths and 360,000 people. That's 229 deaths per 100,000. And Pickett County, which has had the least number of deaths, just 23 deaths, but they only have 5,000 people. and that turns out to be a 454 deaths per 100,000. So if you look at Warren County's numbers, if they were doing like the rest of Upper Cumberland, you have saved 20 lives from what would be expected, because you have only 182 per 100,000, the Upper Cumberland region 229. That represents 20 lives. Whatever you're doing, you save 20 lives in Warren County. If you weren't doing any more than Pickett County, you've saved 114 lives. So I think Warren County is doing an excellent job on that. Right now, you're putting out about 75 shots a day, and I think that is bound to increase as more vaccines become available. You have 12%, about 13% of the people there has immunity from disease that have been tested and said that they're positive, and about 13% have received the vaccine, the first dose. So at least 26% has some degree of immunity, but that does mean that 75% or 74% may still be susceptible, and everybody needs to keep wearing their mask in public. I got a hunch. This is why your numbers are better. I just have a hunch that you're doing better in public, protecting everybody else than some of our other counties. But you're to be applauded on that. And I think the numbers for Warren County really do look good to me.
Well, I'm continuing the face mandate through the governor's executive orders. It's working. I think people have kind of adjusted to it, and so I don't see any reason to let our guard down. I did that once in the past when the numbers dropped, and I regret doing it because our numbers spiked again against that, and the number of deaths increased. So I think most people are in a routine now, and they realize the benefits from it. And even though we still have, anti-vaxxers, anti-mask wearers, the majority of people understand that it is necessary to keep our kids in school and our businesses open. And to protect those people who are most vulnerable, to take that action. So we're continuing on. Like I said, it's not been an easy task, but we have done it.
No, I think, sometimes we focus on the few that are defiant, but, I think it's just best when looking around, look at all the people who are compliant. And really, when there is a death, they probably died because somebody wasn't wearing a mask. And I think as we get further along with this, the deaths will start coming down because basically at this point, they're totally unnecessary. We can prevent those, but everybody still needs to be wearing masks. So you're doing the right thing, and the people in Warren County obviously are, and you're really to be commended for it.
Well, I've been receiving a whole lot more positive calls than negative calls, so we just have to keep moving forward. So what is your take on the variants that are out there, these mutated strands of the virus, and the effectiveness of the vaccine and the efficacy of what we have available now? Do you see that as a threat? Do you see that as something that will be a challenge with the vaccines that we have available now?
The thing we're making history with these vaccines because of the way that how quickly they can make a fix for the vaccine. So I think that being able to identify these variants ahead of time is just an advantage, particularly with this messenger RNA technology that we have. Moderna, created their vaccine within 60 days of getting the genetic code of the coronavirus from China, and that is just amazing. And of course, they're already working on that now for this South African strain, which is the worst. What I think is probably going to happen is that they'll be coming up with booster shots, and it probably won't matter which vaccine you got first, but I suspect that they'll be coming up with messenger RNA booster shots to get whatever we were missing with the latest strain. So just like the flu vaccine, it changes every year, and we know that. but now we've really got technology to respond to that very quickly. I think the main thing right now for everybody to get a shot, it doesn't matter which shot they get, and don't be confused by the data that's coming out that the last shot has more resistance than the first shot because they didn't have these variants when they came out with the first shot. And so when they did their studies, they didn't have the variants. And this last Johnson & Johnson and Pfizer vaccine, AstraZeneca vaccine, it's called a viral vector vaccine, it had its trial in South Africa, and that's where this worst variant is going. So these others weren't tried in South Africa, so it's really a little bit unfair to say that it's not as protective. I think everybody needs to get the vaccine that they can possibly get, and later down the road, I suspect we'll be getting booster shots with these other mixes in the booster shot. That's my guess. But you know, every day is new with this. But that would be the logical thing from a medical standpoint to not be so concerned now about what's going on in South Africa. Be concerned about what's going on here. And plus the fact that if we just wear a mask, we'll reduce the chances of new variants because if we could just get everybody to stop spreading it, getting the asymptomatic carriers, stop them from spreading it by getting them to wear a mask, then we won't have as many new variants. But with the whole world having this virus, there's bound to be thousands of variants out there. So I don't think we need to focus on that right now. We just need to focus on wearing a mask, protect everybody else. Even if you've had the vaccine, still wear a mask. If no other reason, to set a good example for a responsible citizen. Wear a mask when you're in public. And then the other thing is when when they do have booster shots, be in line for those, and be sure to be in line for vaccine. And everybody needs to know now, I think all our health departments now are vaccinating everybody over 65. So all you have to do is call and get an appointment, and the vaccines are here. So there's going to be very little excuses for anybody not to get the vaccine over 65 in the next few days. They should be able to get it. And once all that population is vaccinated, I think we'll really see a decline in these deaths. But right now, deaths are to be followed because we can prevent these deaths.
Have you been happy with the rollout of the vaccine, the speed and the availability of doses? Because it's been kind of inconsistent across the state. We've been blessed here in Warren County. We've got several pharmacies, plus the hospital, plus our health department. And we've even been doing some clinics. We did one at the Senior Center yesterday. We're doing another one at the Housing Authority's high-rise downtown tomorrow. So have you been happy with the rollout of the vaccine and the speed and the delivery process?
Well, I don't know that. I think we all should be amazed at how quickly they came out with this vaccine. And, of course, it's come out one at a time. But I think I am pleased to see that it's coming out even more and more rapidly all the time. Right now, you've been injecting 75 shots a day for the last 72 days in Warren County. And in the Upper Cumberland, we've been injecting 700 a day. I'm only keeping up with shot number 1 because those have some degree of immunity. But I'm pleased with the way things are going forward. And I think the thing is for everybody now that as they become eligible to get in line and get your shot. And I would not focus so much on those anti-vaxxers and the people who are vaccine are resistant. Just thank them for their sacrifice. Take their slot and get your shot.
And that's what I've been telling people to do. Don't worry about the naysayers. If you're wanting the shot, we'll figure out a way to get that for you. So our senior center did over 100 vaccines yesterday, 100 doses. So that went a long way for those people who are normally our best customers at the senior center. So they were happy to get the shots and came early. So do you think moving forward, there's been a lot of misinformation, but at what point do you think that, the herd immunity will actually kick in and it'll be a little bit more safe as a nation or as a community to move forward? I know they talk about at least having 70% of the people vaccinated or having immunity from previously having COVID, but where do you think we are in moving forward with that? And do you have any estimation of a time frame when you think we'll reach that magic point?
Well, I'll tell you, with smallpox was in the world for 12,000 years, and it killed 30% of the people that was attacked. The people who survived had the herd immunity. But herd immunity does not get rid of the disease.
No.
Only when everybody gets vaccinated does the disease go away. So the way I would answer that is herd immunity, to me, is when everybody who wants a vaccination has one. So once everybody that wants one gets one, I think we have herd immunity at that point. The people who don't want it, that want to get the disease, then they're the ones that don't have it. So we can't force that on them. But when everybody that wants the vaccine has it, I think at that point we can go back to normal activities. Those that want it will be protected. Those that don't want it can go ahead and get their natural disease. The biggest concern going forward, I think we're going to have with this virus are the long-termers, because we really don't know what the long-term outcome is going to be, and a lot of us are really concerned about the children. They may be destined 30 years from now to be having problems after this, but how in the world would you know that when the pandemic's not even a year old yet in the Upper Cumberland? We just don't know what's going to happen long-term. But I'm not going to worry too much about the people who don't want the vaccine. I just think we need to do everything that we can to be sure that everybody that wants it gets it, and that we get it to them as quickly as possible. When everybody that gets it stops coming, that's when we have herd immunity and we go back to normal.
I know a lot of communities have started to reduce the restrictions because of the numbers being so good. We're going to continue to do what we're doing in Warren County, at least through the governor's executive orders and the time frame that those are in place. What are your feelings about reducing restrictions? I know Rutherford County took away the face mask mandate, and a lot of other communities did as well. Let that expire.
Well, I'll just tell you myself, Mr. Haley, I feel I haven't been vaccinated. I will not be seen in public without a mask, because I think I need to set a good example for everybody else. And I think we need to go back to activities, but the people that reopen and they aren't following the guidelines, I personally just wouldn't patronize those places, and so you won't see me there. So I think the people who do their best to follow the guidelines will fare the best. You can see that some of the businesses that are just doing a whopping job. But Chick-fil-A amazes me. You go through there, and they're selling more chicken sandwiches than ever before, but nobody walks into their inside the restaurant. So anyway, I don't think there's anything you can do about people wanting to reopen. But for those that are interested in protecting everybody else, I think I would just recommend they don't go in there if they aren't practicing, good the CDC guidance. But I think we're going to be entering a point where those who are following the guidelines will thrive, and those that won't will probably be punished until the numbers get better. I believe. I don't know. But I don't know. I don't think there's any way that we can force people to not to do things, and I'm not sure that's really necessary. I think there's enough of us who want to protect others that we can just set an example for everybody else. And I think that's what you're doing in Warren County. I think you're setting an example for everybody else.
Well, we've appreciated your input and the data you've shared with us over the course of the last year. As we kind of close up conversation, are there any words of encouragement or words of hope that you'd like to share with our listeners today?
No, I think it sounds really good with the vaccines that are coming out, and I would not recommend that anybody yet go vaccine shopping. When your number's up to get the vaccine, get it. If it's the Johnson & Johnson, if it's the AstraZeneca, if it's Moderna, it doesn't really matter. They all are creating messenger RNA of the coronavirus. They all are using the same genetic codes. They all do the same thing. There probably will be later shots, but the main thing is to get into the program that you are offered when you were first offered it and get immunized so that we can get that herd immunity to where everybody that wants the shot has the shot, and at that point we can certainly fully open up.
Well, we want to thank you for your service, your updates, and the data has been valuable. It's helped to drive a lot of my preparedness team's decision making over the months. We look at real science, we look at real data, and that makes for real choices, which are sometimes hard to make. But we've also seen how some poor choices across the Upper Cumberland, how much that has cost those communities. So, to end with a little quote from Mahatma Gandhi, he said, "It's health that is real wealth and not pieces of gold or silver." So thank you, Dr. Gray. We'll stay in touch. I enjoy our conversations and updates. I consider you an expert and a professional in your field, and I appreciate the work that you do at the Upper Cumberland Medical Society and the help that you've given us over the last year during this pandemic. So you take care and you be safe, and we wish you well.
Thank you, and thank you for your leadership by example. I really admire you the way you're doing that. Thank you very much.
Thank you very much. You have a great day. We do have some more updates today, so I want to welcome Lana Whitlock, who is the director at our Warren County McMinnville Senior Center, about our vaccine clinic we had yesterday and some upcoming other clinics that are scheduled.
Good morning, everyone, and thank you, Executive Haley, for letting me come and speak to everyone today. One of our main focuses right now out at the Senior Center is to try to get everyone vaccinated. We've been calling the members of our community that are 65 and older to help them get an appointment for their COVID-19 vaccine. We have been able to get them into our local health department, Stacy's Wellness Pharmacy, and Gray's Pharmacy. We're extremely blessed in our county to have as many places to receive the vaccine as we do. Some areas in our state only have one place to receive the vaccine, so it makes it really hard for everyone to get in. One of our main interests is to get as many people vaccinated as we can, so we offered our very first clinic yesterday at the Senior Center, and this was made possible by Gray's Family Pharmacy. We were able to vaccinate 120 people yesterday. They will return on March the 29th to get their second shot. We're scheduling a clinic tomorrow at Spangler Towers. That clinic will begin at 1 p.m. tomorrow afternoon. The third clinic they're going to have is going to be Monday, which is the 8th. That's going to be at Rebel Hill Activity Center, which is located at 607 North Chancery Street. Gray's Family Pharmacy will also be providing the vaccines for these clinics. If you know of a senior that is 65 and older and they've not received their first dose of vaccine, please give us a call. The only thing they have to do is bring a driver's license or a form of ID and their Medicare card, which is the red, white, and blue card. If they're not able to get to one of these clinics, give us a call. We can get them into one of the local pharmacies or the health department so that they can receive their vaccine. We are also helping with transportation. That is through the UCHRA. If someone has issues trying to get their vaccination, just give us a call. We'll get them some transportation tickets. We also have had several calls about people wanting to come just to our center to get their second shot. You must go back to the first place that you received your first dose. That's how they're already allocated. Now, my challenge to you is to help us get everyone into a clinic or our health department. This is very important for our senior members of our community to receive this vaccine. We are trying to accomplish this so that we can get our center back open safely. I encourage each and every one of you to do your part and to get your vaccination when it's your time. If you have questions about needing any kind of resource for a senior member of our community, please give us a call. If there's no one, if we don't answer, please leave us a message. We are in and out because we are still providing resources to the members of our community. The number is 473-6559. Thank you.
And thank you, Ms. Whitlock, and very much thanks to Grace Pharmacy, who I think over the last couple of weeks have done over 500 doses through that pharmacy. Our success, as you know, depends upon the number of people that we vaccinate across the community, as Dr. Graves alluded to earlier. The more doses we give, the less scarier the future will be. So a shout out to the health department. They are still vaccinating. That online portal allows you to register for your first dose, and they will give you a card that allows you also to go online and schedule the second dose on the 28th day if it's a Moderna vaccination that you got. So they're still testing for COVID Monday through Friday, 9 to 11. The Guard is still there assisting the health department, but the vaccines are still going through the phases 65 and above through 1B. We're not really sure when the phases will be expanded because the distribution of doses across the state varies from county to county. So Warren County has been blessed to receive more doses than many rural communities have received. We got more places that can vaccinate, the hospital, several of our pharmacies, the health department, plus the clinics that we're scheduling out in the community. So we do have the vaccines available. Please follow the program and the plan for registration or the guidelines for those, and we can get you vaccinated. There are waiting lists, so oftentimes if someone does not show up, the person is called next on the waiting list, but they have just a short period of time to get to that vaccination shot, to get the shot. So please be patient, and please, don't do phone calls just to type our lines, just to ask for questions. Call my office, call the health department's main line, and they will give you the information on it. There is great promise with the Johnson & Johnson vaccine that's coming out. It's a one dose. It may not be as effective as some of the other doses, but it will go a long way, particularly as those millions of doses hit the market for distribution. But even though our numbers are down and the vaccinations have increased across the nation and across the Upper Cumberland, we cannot let our guard down. Even though the numbers are down, hospitalizations are down, deaths are down, it's only because we've been practicing the guidelines since the very beginning and encouraging each and every person to wear a mask, use personal hygiene, do the social distancing, avoid spreader events. If you're asymptomatic, please do not go out and jeopardize the health of others. We have to protect the safety and security of our entire community, and we have to do that through cooperation. It's the least we can do. If we want to keep our kids in school, our businesses open, and government services provided, we have to work together as a team and cooperate. The governor's executive orders have been extended. Virtual meetings have been extended. Some of the healthcare long-term facilities are now going to allow visitation, and that will be starting this week and next. So you'll need to call those facilities and make sure that the guidelines that are in place are followed if you're going to be visiting loved ones in some of our nursing homes and assisted living facilities. They still will require face masks. They still will require guidelines to be followed, but it goes a long way in allowing for families to reconnect with sometimes it's been almost a year. So my emergency orders will still stay in place. Our face mask mandate will stay in place. We will still be using Zoom meetings or hybrid formats and government meetings moving forward. Those will be adjusted as numbers are adjusted or as executive orders from the governor come down to us. On building operations, both the administration building and the courthouse are back open 5 days a week, but there are guidelines to enter the building. Chief Justice Bivens has reopened court beginning at the month of March and into April to do in-person court cases again. So please call those offices as much as possible in order to find out on your court dates. The messaging has gotten out, And so we are working diligently to try to return as much normal to our operations as we possibly can. The jail and EMS and other operations, that's the discretion of those officials, and the access of visitors to the jail may still be restricted. Those will be at the discretion of the sheriff and his staff to protect that inmate population and his correctional officers in that facility. If you got questions about a county operation or an office operation or the services that are provided, including sanitation, if you will just call those offices or my office, 473-2505, we will try to give you the updated versions. My webpage on the county website gives the updates and the newest executive orders and the CDC guidelines and the vaccination phases as well. So your support and cooperation have taken us to this point. We should be proud of our success and where we are. We have done better and fared better than almost every county in the Upper Cumberland, and a CDC report about which schools, elementary schools, could open effectively and safely. Warren County was the only county in the entire Middle and East Tennessee that got that status. And there's very few in the Southeast that have gotten to that point. So our success has been attributed to teamwork, following the plan and the guidelines. So we want to thank you. No one knows where this is going to go, how long it's going to play out, whether it's going to be midsummer or the end of the year, but we do see the light at the end of this tunnel. We do see great hope. We do see that things are improving to the point where some sense of normalcy will be restored, hopefully soon. So once you choose hope, we realize that anything is possible. So as we move forward, I'm going to basically suspend our Ben Lomond live streams over the next course of months. We'll probably be doing these once a month as uptakes become available. And so that will allow the information as it changes, but our numbers are there. We're almost to the point where we can restore some kind of faith in moving forward. But as our information changes, we'll be working with BLTV, just as we have for the last year. It's been almost a year now. Ben Lomond has been an amazing community partner throughout this whole process. PEG Broadcasting, The Standard, WCPI, WCTE, and the media outlets across the Upper Cumberland have shared information and scheduled changes and data that has been real science that's been shared with all of our listeners. And that's been important in moving forward, getting the message out to those who need it the most. Information has always been important. It's been a variable in our formula for success since day one. So we want to thank each one of our media outlets and our community players in getting the information out as much as possible. So it has worked. We do see the progress. We do see what we have done has worked. We are a remarkable community. Our strength has been working together each and every day to carry us through this pandemic and this challenge. It's not been easy. Our course will get better as time plays out and more vaccinations are available and things are restored. We did it. We're not exactly where we want to be. We're not exactly where we thought we would be, but we're closer to our goal, closer than we ever have been over the last year. Normal will be restored. We don't know really what that new normal is going to be. Businesses have changed. New marketing techniques have changed. People are working from home. Zoom meetings and conferences, all those things are probably going to be adapted and adjusted because that's what we do to survive. So we want to thank you, all of our listeners, every resident of Warren County. We want you to take care and be safe. Go Pioneers! And as always,